Good day and welcome to Mrs. Bam's Study Notes. Today's topic is understanding disability. We are going to look at the models, types, and some communication. Disability is perceived and experienced differently across cultures and societies. Scholars have developed a variety of theoretical frameworks, known as models of disability, to better understand these perspectives. These models, although not always explicitly discussed in daily life, strongly influence public discourse and social attitudes. The first type of model that we get under models of disability is traditional or deficit-based models. These models see disability as a problem that is part of a person. They believe that the person needs to be fixed or helped. Number one is the medical model. This model says disability is a sickness and something wrong with the body. The person must find a way to get better or adjust. Number two is the rehabilitation model. This focuses on therapy or training to help the person improve. Number three is the expert model. Professionals decide what is best for the person with the disability, and the person has little or no control over what the professionals decide. Number four is the functional solution model. This model looks at tools or technology to help people with disabilities in daily life. It helps practically, but it doesn't focus on changing society. Tragedy model. This model portrays disabled individuals as victims deserving pity and reinforcing harmful stereotypes. Number six is the charity model. This model presents people with disabilities as dependent recipients of kindness, emphasizing benevolence over rights. Number seven is moral or religious models. According to these models, disability is a punishment or a result of sin, bad luck, or spiritual causes. This can often lead to stigma, exclusion, and even harmful practices in certain communities. Next, we have social or rights-based models. These models focus on society and how it treats people with disabilities. They say people are not disabled by their bodies, but by the barriers in society. First, we have the social model. This says that people are disabled because of buildings, laws, or attitudes that exclude them. The problem is not with the person, but with the environment. Number two is the human rights-based model. According to this model, all people, including those with disabilities, have the same rights. Disability is a natural part of life. Number three is the empowering model. The person with a disability chooses what support they want. Professionals help, but they don't decide anything. In other words, they emphasize autonomy, encouraging individuals to make their own decisions with professionals acting as supporters. Number four is the affirmation model. It sees disability as something to be proud of. It promotes a positive, non-tragic view of disability, seeing it as an identity and a source of pride. The third type we get is holistic or combined models. These models try to mix different ideas to understand disability in a complete way. Number one is the Biopsychosocial Model. This model looks at the body, the mind, and the environment together. According to this model, health and disability are affected by many things like feelings, support, and culture. Number two is the economic model. This model focuses on money. It looks at how disability affects work, income, and the economy. Number three is the human development model. This model integrates environmental and social participation factors, focusing on how accessibility and inclusion affects individuals' lives. Next, we are going to look at the types of disabilities. Disabilities can affect people in many different ways, and in South Africa, they are often grouped into 5 types. Number 1, physical. Number 2, sensory, like sight and hearing. Number 3, intellectual. Number 4, psychosocial, or mental health. And number 5, neurological, or the nervous system. Some examples include vision or hearing problems, mental health conditions like depression or anxiety, intellectual disabilities that make learning or daily life harder, learning difficulties like dyslexia, dysgraphia, or dyscalculia, developmental conditions like autism or ADHD, physical disabilities such as paralysis, cerebral palsy, and injuries, short stature or dwarfism, and conditions like spina bifida or amputations. Let us also look at communicating with people with disabilities. Effective communication with people with disabilities requires intentionality and practice. It is important to use appropriate language and be aware of individuals' preferences and needs. Being respectful, patient, and open-minded lays the foundation for inclusive and empowering interactions. It is important to use respectful language, be patient and listen, ask how the person prefers to communicate, and focus on the person, not their disability. Understanding the different ways people experience disability helps us become more respectful, kind, and inclusive. When we learn about the challenges people with disabilities face and how society can create or remove those barriers, we can change our attitudes and actions. Good communication means listening, being patient, and treating everyone with dignity. By learning and practicing these skills, we can all become better people and help create a more equal and supportive world for everyone. Join me again for Mrs. Band's Study Notes.